Now this lady, 25 plus years, uncontrolled diabetes, meaning her blood sugar is up, down, okay? Now, what brought her to the doctor is she had an eye hemorrhage. And that alarmed her because she lost part of her visual, like it impaired her vision quite a bit apparently. So this is something, we're not going to get into this in big detail, but autonomic neuropathy, a little bit, it's still peripheral neuropathy, nerves outside of, in your body, outside of the central nervous system. But maybe next webinar, we'll get into this in more detail. But for now, what I want to point out here is this is widespread throughout her body. I mean, just to simply say, and then you have a bunch of symptoms that show up with that. She's depression, high blood pressure, gastrointestinal issues. She has to urinate frequently at night. And obviously what brought her in, what alarmed her to go seek medical attention is the eye hemorrhage, okay? Now, for us, why I'm showing this is what happens if we stabilize a system? What can happen? What about, will it improve quality of life? Because she's got quite a few things going on, and let's say the eye hemorrhage, just the straw that broke the camel's back that got her there. And what happens if we address the underlying nerve dysfunction? Because with autonomic neuropathy, it can start to be much more than just the limbs and start to affect a lot of organ function. Very serious, can be. So if we address that underlying nerve dysfunction, what about those separate symptoms? So she was at the clinic, Dr. Klassen, and they did coMra sessions twice daily. Apparently she lived close by, for 1 week. So she'd come twice a day for 1 week. So they treated her, let's say, circulatory system, all right? Then they treated her, what we would call her, right here would be her pancreas, which is part of the important part for diabetes. So part of the, let's say, damaging factor. We're able to address that to some degree. And then treating her enteric nervous system. Again, we'll get into that in more detail at some other point. Of course, also addressing her eyes along the way, but centrally treating her whole peripheral nervous system. You can see all the points done in the middle of the spine and all along the sides of the spine, okay? And as I said, treating her eyes. Now, important note, eyes closed anytime you're doing these kind of treatments. So with that, she continued her medications as normal, by the way. So her blood glucose managed to go down from, let's say, yo-yoing as it was to more stable, not ideal, but more stable. No change in medication. So you can see this indicates a functional recovery of the system. The enhanced self-repair is bringing some functional recovery for that whole system. And you can see nighttime urination down to 1 to 2 times a night. That's actually pretty normal for people when they're older. Blood pressure improved. She didn't feel depressed anymore. Gastrointestinal issues. So this is system-wide improvement. And this also touches on this 3-principle approach, which I'll show you a little more later. This is another aspect of it, okay? And also note, this lady, you know, it's not like she's out of the woods, so to speak. It's more that there's progress, all right? And that state of her nerves having a huge impact on her overall quality of life. So enhancing self-repair, lots of ripples. So this is part of the reason we wanted to show you this.